We'll get started in just 1 minute. We're going to wait just a moment more for other attendees to join. Good afternoon, everyone. My name is Jennifer McDuffie, and I'm the Associate Vice Chancellor of Student Affairs here at CU Boulder. I'll be moderating today's call. Some quick housekeeping items before we get started. All attendee lines will be muted throughout the call. When we get to question and answer, please place your questions in the chat function at the bottom of your screen. We'll do our best to get to all questions. And if you don't get your question answered, please know we will share our colorado.edu/COVID-19 website. As a reminder, today's call will be recorded, and this recording will be added to that COVID-19 website. On today's call, we have Pat O'Rourke, our Interim Chief Operating Officer, Russ Moore, our Provost and Chief Academic Officer, and Jeff Sayek, the Executive Director with Boulder County Public Health. In addition, we're joined by Doreen Jokerst, our Chief of Police, Catherine Eggert, Senior Vice Provost for Academic Planning and Assessment, Katrina Spencer, our Associate Vice Chancellor for Budget and Finance, and Sarah Huntley, the Director of Communication and Engagement with the City of Boulder. I'd like to turn it over to Pat O'Rourke to get us started.
Thanks, Jennifer. And am I on mute? Can you hear me?
Yes.
Great. Thank you. So wanted to first thank everybody for tuning in again this week. These sessions have proven to be one of the highlights of the week for a lot of us in the community. It gives us a chance to be able to let you know what's going on, to be able to hear your concerns, and to be able to discuss with you the issues that we're facing. Over the last couple of weeks, we've been on a little bit of a roller coaster ride, moving from where we had a tremendous outbreak in the student population that was driving numbers of infections in the community to seeing a really fantastic response from our community that allowed that curve to be able to bend back downwards. Boulder County Public Health recognized that, put in place some orders. We've been able to come back to classes, have limited social interactions, and be able to return to a more normal mode of campus existence, which is really wonderful. We're continuing to move forward to try to meet CU's educational mission and to make sure that the college experience is one that's worthwhile for our students. But we're at a really critical moment right now. COVID cases are rising all across Colorado, and in particular, we're seeing a surge in the Denver metropolitan counties. Some of the counties like Denver and Adams County have already placed additional restrictions on the activities that their residents are able to engage in. And we want to make sure that Boulder County remains a safe place, not just for our students to be able to live and study, for our faculty and staff to be able to work, but for the community members as a whole. And that even though we've been successful over the past few weeks in really being able to drive down some of those infections within the CU population, we're coming up on a critical time. Halloween's coming up. We need our students and community members to stay vigilant, make good choices. There's going to be more details on how students can enjoy their Halloween, have a healthy and safe one Student Affairs has been working actively on that. I would remind everybody that gatherings are limited to no more than 10 people from 2 different households. And so that can actually mean that the gatherings are of less than 10 people, because the definition of a household is actually pretty restrictive. That's something that came through from the Colorado Department of Public Health and Environment. We need to make sure that we're staying in line with all of those public health orders. They're there to be able to protect the community and to make sure that we're able to make it through the semester. And we encourage all of our students to also take advantage of the activities and events that are being sponsored by Student Affairs. Jennifer McDuffie, who's hosting this call, will talk about that more later. But because of the increasing number of positive COVID cases in the state, we know that we're going to be subject to changes potentially over the next few weeks. Executive Director Zayak will be able to address that, where we are in the county, what we need to be doing. But it really boils down to a few simple things. We need to make sure that we're engaging in proper masking behavior at all times. We just can't let up on that. We need to be limiting social gatherings. One of the things we saw is that the big spike in cases occurred when we had some large gatherings that were occurring, and those are exactly the type of behaviors that could lead us into having some trouble again. And people need to just do the common sense practices: hand wash, maintain distance, respect your neighbors, and help us get through this as a community. Finally, we are coming up on an election week as well. This is an important week for a lot of people in our community, and we're encouraging all of our faculty, staff, and students to vote if they haven't already. Details on voting locations, events, and information can be found on our website at colorado.edu/elections2020. Please make sure that you're doing that. It's important that all of your voices be heard, no matter how you vote. And so with that, I'll hand it over to Provost Bohr.
Thank you, Pat. And I'd also like to thank the over 800 participants in last week's town hall. Most of those were students, parents, and others who attended, and we appreciate the opportunity to communicate with you. The spring semester will start on January 14th, with move-in starting on January 11th. I would like to reiterate that the data-informed decision to forego spring break was a very difficult decision to arrive at. We know that students, faculty, and staff traditionally use that time to recharge. That said, we will continue to err on the side of keeping students and our communities as safe as possible as we navigate this pandemic. But we encourage everyone to take advantage of the wellness days that have been scheduled and the activities that support mental and physical health that will be available on campus. For those wellness days, I want to emphasize something. We are working to make sure that the faculty, students understand that these are truly days off. These are not days for makeup classes or to work on assignments that would be due the next day. These are real wellness days, days off. In order to make them truly beneficial for everyone's physical and mental health, we have to attend to those principles. I'd like to highlight an important announcement that came out last week. CU Boulder is allocating substantial resources to support an expansion of mental health and wellness support for undergraduate and graduate students. Jennifer McDuffie will share more details with you in just a bit. Finally, with fall semester coming to a close, I want to encourage our students to focus on finishing strong and staying healthy. Now I'd like to hand it off to Jeff Zayak for an update from Boulder County Public Health.
Thanks, Provost, and thanks to all of you who are tuning in again today. What I'm going to do is walk us through the data from this last week so everybody can see where we are, and to also talk about some of the challenges as we move into these next few weeks, which we know will be challenges for us. Somebody can let me know when they can see that. Thank you, Jennifer. So the first thing I want to do is just point out where we are on the dial at the state level that you've heard me talk about in previous weeks. Right now, Boulder County is at 187.4. Unfortunately, that means we've jumped from safer at home level 2 to safer at home level 3. And as a reminder, I'll cover a few of these at the end, but we do have some more restrictions. We will have at least 2 weeks to try to get our incidence rate down below this. And right now, of the 3 indicators, this is the one indicator that is exceeding the safer at home level 2. And I'll talk about the challenges and why it is going to be difficult to address some of this. The second indicator is our 2-week testing positivity rate, which is at 4.1% on the dial. So we are still in the green for that. And our hospitalization status is 11 days of decreasing or stable hospitalizations. But it's important to note that we're still at 48 hospitalizations in our county, which is much higher than we've seen in the last couple months. This is the great news again, and again, a thank you to our students that are on today and watching this, and to the parents that are supporting them. The light blue graph is the student numbers or the CU affiliated numbers, and the dark blue graph is our county residents that have been positive. So what you can see is that the students did change behaviors, they did take responsibility and have made a difference here. Our numbers are much, much lower in terms of students. And again, what you're going to hear me say is very similar to what Pat said, which is this really does come down to individual behavior change and taking responsibility for our own actions. That's the only way to truly drive these trends down, is for people to follow the orders that are in place, to take responsibility. And we can see that students have done that. Unfortunately, as you can clearly see here, we are seeing increasing trends in pretty much all age categories at this point, which I'll illustrate in a second. This is again just the 18 to 22-year-old spike that we had, and the significant decrease in that spike now down to a baseline. And we can't give up yet, as I'll show you in this next couple slides. So right now, we are at actually level A in terms of our incidence rate for cases, which is a little bit higher than the 250. And we are at our baseline in terms of our positivity rate for 18 to 22-year-olds. So that is looking good as well. And again, this level, even though it's above our baseline slightly, is indications of where we are with other populations, which I'll show you in a second. So again, our students have been doing a good job. Please be extremely diligent, especially as we go into this Halloween weekend, which I'll highlight a little bit more. This is the challenge that's in front of us. And what you don't see in this age group category is the 18 to 22-year-olds. We'll add those next week because you saw the graph was really a large spike. It would have been difficult to see all these lines. So we'll add the 18 to 22-year-olds next week for a couple week period so you can see where it fits in this. But what we're seeing right now is actually a little higher rates than the 18 to 22-year-olds in our 25 to 34 and our 25 to 44 age categories. So this is consistent with the baseline of the 22-year-olds at this point. They're the 18 to 22-year-olds at this point. So we will not be changing categories based on this. But what we do have based on this, as you can see, is an illustration of increasing numbers across all of our age groups. That is going to be a real challenge. When we're in this type of situation, it means the community as a whole has to act. We have more virus circulating in our community right now, and it's going to be critical as we move into these next several weeks and months to really maintain social distancing. It's absolutely critical. This virus can't spread unless we are within 6 feet of each other, or we are not masking, or we're not being diligent about washing our hands. So we need to maintain those things in order to control the spread of this virus. And again, I'll talk about why that's important, especially as it relates to what happens in our community if we have to move to level 3, or even worse, if we had to move to stay at home. These are the key takeaways that I wanted you to all really just remember. Again, we're seeing increasing cases statewide. So if I showed you the graph that I showed you last week from the metro, you would see that those metro counties, especially Adams and Denver, as you heard Pat mention, have significant increases, again, across all age groups. We do have increasing cases in all of our age groups in Boulder County, and hospitalizations are increasing statewide and locally. We have developed, as you all know, a strong plan with the City of Boulder, Boulder County, the university, and Boulder County Public Health. And so far that plan is working. And that again is because we have students taking responsibility and parents supporting that responsibility. So thank you again to all of you. We need you to continue to be diligent as we move into the fall and winter period. We know that people are going to be indoors more. We know that holidays equal gatherings, and that around the holidays, people have a tendency to get together. Our first challenge is going to be with Halloween, which is only a week away. And we really need people to make sure that they are celebrating Halloween in a safe way that includes social distancing. We cannot have gatherings, or we'll continue to see spread of this disease beyond what we see already. Because of the number of outbreaks across the state that we're facing right now, our statewide capacity for doing contact tracing and case investigations is significantly diminished. It's much more diminished than when we had the CU surge that occurred a month and a half or so ago. We don't have that kind of backup in our system right now because the state backup that existed is having to respond to so many of the other outbreaks that are occurring across the state. So we cannot afford a surge. A surge now would mean that we could lose control of the spread of the virus and be quickly in a stay-at-home situation. So I can't emphasize enough those same messages that Pat said. We have to take personal responsibility as we move into this Halloween weekend and as we move indoors to make sure that we are not gathering in large groups and that we are wearing our masks. We, as you all know, we also have flu mixed in with COVID in the fall, and that's going to be a challenge. So important message is to get your flu shot, and that will help in terms of what we see happening in the fall relative to impacts and issues within our healthcare facilities. We know that people are having COVID-19 fatigue, but the message is to stay diligent. We're going to get through this. It's taking longer than I know anybody wants it to take, and that goes for all of us as well that are on this call. We certainly don't want to be in these situations. We don't want our students in these situations. We don't want our communities in these situations, but we need to stay diligent to get through this. And then again, I won't repeat, but the individual behaviors drive the outcomes. Please take it seriously. It's extremely important for us to pay attention to that. And I just want to highlight again what it means at safer level at 3 in just a few of the categories so people can remember the impacts this has on our community, on our economy, and on our social and behavioral health. So we are in safer at level 2 now, which means if we had to move to safer at level 3, our restaurants would go from 50% capacity to 25% capacity. Our manufacturing would go from 50% capacity to 25% capacity. We would have to limit the number of gatherings that occur. Our offices would have to go from 50% capacity, which is where they're at right now, to 25% capacity. So this has multiple impacts across all of the services in our community. Again, from an economic standpoint, a physical standpoint, a mental standpoint, all of those things are significantly impacted as we have to move up the dial with more restrictions. So it's really important that we all take it seriously and we do everything that we can to support making sure that we're not spreading this disease anymore. And I'll stop there and stop sharing this.
Thank you so much. Thank you to Jeff. Thank you, Provost Moore. And thank you, Pat, for the great information. I'd like to share a few details about Halloween and mental health support that was mentioned previously. We are grateful and excited to share that $1.8 million investment is being made towards expanding mental health. This will go directly to expanding mental health providers, resources, workshops, and individual therapy in the colleges and schools. Additionally, this funding increase will support undergraduates and graduate students, as well as prioritize multicultural competencies among our staff. If you're a student who is interested in utilizing services, we encourage you to go to our counseling and psychiatric services or our Office of Victim Assistance. We have drop-in appointments and 24/7 support. Additionally, we have a lot of programming, prevention, education, and intervention this week and next. So when we look at Halloween, our student affairs colleagues have come together to plan an amazing series of events, from virtual events like trivia to pumpkin carving. And to help students celebrate Halloween, we have movies and other ways where we can gather safely and also engage with fellow students as well as others in the community. A full list of these events can be found at colorado.edu/Halloween-2020. We are very proud of our students and well as our faculty and staff. The Buffalo community has really come together to protect our herd, and we're excited to answer your questions. Before we do that, I do want to introduce one of our panelists, Dr. Chris Urbina, who is here. He's the medical director at Boulder County Public Health. So now I'd like to take this time to open up for question and answer. If you have a question, please feel free to enter it into the chat feature at the bottom of your screen. We are prioritizing questions from students and family members. So this first question, Pat, I'm going to direct to you. I'm glad the university has devoted more money to student mental health support. Has there been any discussion of giving students more free counseling visits? And Pat, I believe you're muted.
It's easier to answer the questions when you're muted.
I agree.
So that's something that we have to have a longer discussion about. One of the things that we're finding right now is that just our capacity to be able to meet the demand for students at even within the current structure is being taxed. And so the first priority is just trying to create more bandwidth so that we're able to provide more services broadly. Once we get to the point where we're able to increase the amount of overall coverage, then I think we can look at the depth of that coverage to be able to make sure that we're meeting students' needs more comprehensively. But I would say our first effort is going to be trying to track into making sure that everyone can access services. And
Thank
Jennifer,
you.
you want to add anything on that since you know better than me?
I would say that you did a great job. I think one of the things that you mentioned most is making sure that everyone has access to services. And so how do we ensure that individuals, no matter where they are on campus or where they are remotely, have access? We do also offer unlimited education, workshops, and skill-based groups. And so we found a lot of our students, especially during this time, are participating in those. And our anxiety toolbox happens to be the most popular one right now, followed by relationships and dating. This next question is going to be for Jeff. Jeff, are the new cases that you mentioned coming from students?
No, they are not. They're coming in our general populations. And again, it's every single age group now is having increases. If you look back the last 2 weeks, again, the students, the 18 to 22-year-olds specifically, significant decrease in cases. And from that graph of the light blue versus the dark blue, we can see that we have very few students now testing positive, which is again, really appreciated.
Thank you. This next question is going to be directed at Jeff and Pat. So can you help to clarify the discrepancy in numbers reported? For example, CU reported 19 cases last week, but the county only listed 6 CU-related cases, and the state, in listing the CU outbreak on Wednesday, added 80 infections to that outbreak, far more than either the county or CU reported over the previous week. Can you help clarify?
Pat, I'll boot that one to you to start.
So I think that what we are seeing is that the numbers that get reported on the county normally have a little bit of a delay in terms of what we are reporting on the campus, so that over time those numbers tend to get reconciled, particularly as the confirmation comes in and we get things entered into the overall case management systems. And we are currently working between having some cases that were in a system called Cedars, and now we're importing them into other systems as well. So a little bit of this will have to get reconciled because we know that that's been an ongoing source of confusion, but we do have data teams that are working to be able to do that. Rather than getting caught up in the specifics of what's being reported on a day-to-day basis, what we really want to be able to watch are the trends, so that we're able to see, are we looking at a situation where cases are declining, whether or not we can see whether or not cases are escalating. And like Jeff showed earlier, what are the populations in which those cases are occurring? I will be honest, which is I have not gone back and looked at the CDPHE site, so I'm not sure how they reported the cases that are contained within that cluster. And so let me go back and try to find that out, and we can perhaps get some information out because I wasn't aware of that CDPHE report.
Thank you. Jeff, would you like to add?
Sure, just Pat, if you want to include Emily in that, and as Pat mentioned, we have a data team that is working together on our data. So I copied the question as well, and Pat, if you just want to include Emily in that, I think between our teams we can get a response back out to the whole group.
Yep, absolutely.
Thank you. And Jeff, I think this next one's for you. So what about travelers who are coming from hotspots into Denver and Boulder from other states? Can you tell us what's being done about those?
So we don't have any travel restrictions. I think you're aware probably at a statewide level. And what we ask is that people don't specifically, as we start to think about football games or those kinds of things, the last thing we want to do right now is have alumni coming back in to the county. We want to make sure that we're not doing that and bringing people in from places that are hotspots, but it really does, it's going to come down again to that individual behavior. And if people are making the choice to travel in and get in large gatherings, that is going to create problems for all of us in our community. So the best thing I can ask of folks who are on the phone is to discourage that and discourage it significantly, because we don't want to bring people in from places where we have higher outbreaks. And if you've been following the national news, we are seeing outbreaks in many other states around the nation. So now is not the time to be traveling and potentially spreading the virus even more.
Thank you. Provost Moore, this is going to be directed at you. I'm a parent. Can you talk about the first year academic experience for freshmen that you rolled out this year, and what have you learned? Will you keep it in the future post-COVID?
Yes, well, in this situation, we learn things every day, and that's an unfortunate part of this. But yes, we will continue the first year academic experience. One of the things we've learned is there's a tremendous appetite, particularly amongst our first year students, for in-person experiences. So we're looking to expand those in the future. We actually, for those students who have had in-person experiences, the majority of them think they're actually quite positive. And I taught in one of those this year as well. I thought it was quite positive. Certainly it was an upgrade from being on Zoom all day. So we are being very, very attentive to providing more in-person experiences and also outside of the classroom, more in-person experiences for our students, particularly our first year students who really are looking at coming to the university as not only an academic opportunity, but one for social development as well. So these are the approaches that we're taking.
Thank you. For Pat, are the scheduled wellness days in the spring available to staff as well?
So that's something we're working on right now, and we're starting with the principle that we do want to make wellness days available to staff too. But we have to, at the same time, recognize that there are staff where if the campus is remaining open, and it will, because we're going to have students in the residence halls, we're going to need to make sure that they're fed, we're going to need to make sure that we're meeting the needs of the campus community. So that those type of days for wellness, we'll have to figure out a strategy to making sure that those can be distributed equitably, while still making sure that we're not neglecting the needs of our community. So that's something that our folks in HR are currently working on, is making sure that we have a strategy that recognizes the fact that the staff need to have the same type of opportunities to recharge that the faculty and students do as well. This has been a year where just about everybody has put in efforts above and beyond. And it's the staff who are supporting the student and educational experience. It's the faculty who have had to teach in different modalities and to work through challenges. And it's the students who have been through a semester like none in the past. And we need to recognize that as we go forward with our planning for the spring semester, because these are important that we keep people engaged and energized.
Thank you. For Sarah Huntley, Sarah, if you could share what the city is doing. So the question is, will the city ban all activities on Pearl Street Mall on or around Halloween?
So we have just, hello everybody, I'm Sarah Huntley. I'm the Director of Communication and Engagement for the city. Thank you for the question. We are going to be stepping up our policing presence for Halloween. We are going to have the same number of officers that we typically have at the beginning of the school year, and they'll be spending their time primarily in the Hill area and the Pearl Street Mall area. We are strongly encouraging people to follow all of the public health ordinance that are in effect. We do have 9 homes that are associated with 2 fraternities that are on strict stay-at-home orders, but the rest of the community is being asked to adhere to the public health guidelines that we have received.
Thank you. This next question is related to Halloween. So the activities for Halloween are great. Can you talk more about what you're going to do to cut down on the impromptu parties for Halloween? And will these efforts be focused on or off campus? So I think Sarah just mentioned a few areas of focus, but I think on campus, I'm happy to take that. And then Pat, if you want to add on anything to it. But on campus, we've worked with a variety of stakeholders, including students, to plan educational and preventative events for Halloween. We also recognize that this is a really difficult time for students and they want to gather. So how do we do that safely? So in terms of the impromptu and in terms of the large gatherings, we're working really closely with our CUPD, our police department, as well as our RSOs, our security officers in the residence halls, and with our local city police to ensure that everyone's able to understand and comply with the public health orders. Pat, did you want to share any more about that?
Yeah, so I would, in addition to the programming that Jennifer is describing, the notion that we're going to have enough capability to prevent the impromptu parties from popping up. We don't have the ability to prevent that because we're not at a place where we're restricting students to their dorm rooms, and we're not in a place where people have been confined in their houses. But I need to be real clear that if the disease burden becomes greater and we're moving up through different levels of restriction, and some of the counties in the Denver metro area are trending at a point where they could be under stay-at-home orders, that's the type of thing that we could be facing if people don't demonstrate that degree of responsibility to be able to protect our community. Everybody has to understand what's at stake when we're coming into these type of holidays, and where the temptation to get together and have those type of parties is going to be high. But they're a real risk to our community. And you heard some of the consequences earlier. We've been in a situation where, unfortunately, we've had to suspend a number of students because they've engaged in conduct that are in violation of public health orders and have endangered the community. You heard Sarah Huntley describe that the city has issued orders to houses within the community that put them essentially into stay-at-home status. And so we have less preventative ability. We're trying to create other social opportunities, but we also recognize that these are threats to our community, And when they occur, we have to respond for the sake of the community. So we're asking the parents, please talk to your students right now. We want to be able to make sure we can make it through the semester. For the students, please just take it into heart that we want you to be here. We want you to have opportunities to be able to interact with each other. We want you to be able to do the right things. But we're at risk and in a very vulnerable period of time. And anything you can do to help us get through that is not just valued, but really welcome.
Thank you. Jeff, this next question is directed towards you. Will another order be placed on 18 to 22-year-olds and or all Greek houses or on the whole community? So can you speak more about that?
Yeah, so as I had mentioned, what we need to do now, because we have exceeded that one indicator of incidence rate, for level home 2, we will need to sit down and meet with CDPHE and develop strategies to approach trying to reduce that incidence rate. And the challenge is, it's not obviously just 18 to 22-year-olds. As you saw from that graph, we have increasing trends across all the age groups. So we need to be looking at community-wide approaches at this point versus individual approaches at this point. Obviously, we'll continue with supportive enforcement for any of those collegiate homes that aren't following the gathering orders, because we don't want to see another spike for those very same reasons that you heard me talk about before. We have a pretty stressed system right now. We definitely want people to take responsibility. They have been doing it. But we would continue to look at making sure that gatherings are enforced in those collegiate homes. So hopefully that answers the question.
Thank you. This next one is going to be for Provost Moore. For the spring 2021 semester, for students who need to remain in a distance learning capacity, will all classes have remote instruction availability? And this is not pertaining to lab classes.
Yes, so what we're trying to do is for those small fraction of students who actually desire a completely online series of courses, we are encouraging them to meet with their advisors immediately upon when registration opens so that they can try to arrange that. This last semester, fall semester, I believe, as we entered the fall, 6 to 7% of our students made requests to be all online, and I think that was provided to them. But it's critical for those students who have a need or a desire to do so to engage with their advisors immediately so that we can make provisions to make sure that they're getting the courses they need. If need be, they can be distance or remote or online courses, but we also want to be very, very attentive to providing them the kinds of courses that will allow them to proceed academically and meet their graduation goals in a timely fashion.
Thank you. Pat, can you help answer this next question? For the definition of household, does an individual dorm room count as one household?
And I see Kate Haywood's on the line. So she is one of our public health experts. But Kate, correct me if I'm wrong. I think that the definition of a household that we're looking at is that a dorm room would be a definition of a household rather than thinking about a residence hall as a household, correct?
Yes, absolutely, that's correct. An individual dorm room would be considered a single household, whereas the residence hall would be comprised of many households. So with respect to the public health orders, household means the residential unit where an individual resides. For single family homes or apartments, that's pretty straightforward. It's the entire home is considered one household. Whereas for on-campus residence halls and off-campus congregate housing, such as sorority and fraternity houses, a person's household consists of such person and any persons with whom they share a room in which they sleep. So as stated, congregate housing such as residence halls, sorority houses, and fraternity houses will likely have multiple households.
Thank you. Jeff, this next one is a two-part question. Are K through 12 students being tested at rates comparable to CU Boulder students? And are the increasing numbers across all age groups potentially due to the decision to hold in-person classes for K through 12 students?
I'm going to have Chris Urbina take this one.
Dr. Urbina?
Yes, so could you repeat the question, Jennifer?
Yes, so it's two parts. So the first one is, are K through 12 students being tested at rates comparable to CU Boulder students? And then the second question is, are the increasing numbers across all age groups potentially due to the decision to hold in-person classes for K through 12 students?
Thank you, Jennifer. Those are great questions, and I appreciate the opportunity to answer them. Unfortunately, not all K through 12 students are being tested. Right now, the current strategy is if they have symptoms or they're concerned about being and potentially contact to an infection, that's when we're recommending that children get tested. So I think the students at CU campus are tested much more often than those K through 12 students. There's just not comparison because we're doing symptomatic as well as contact testing in those populations. And the second question is, yes, it is possible that anytime you bring people away from their home, back to school or to a indoor setting or a group setting, it does increase the likelihood of infection. But I'm watching some of the schools at St. Vrain, Boulder Valley, and some of the other communities. The schools have done a very good job of enforcing and putting recommendations in place regarding masking, personal and physical hygiene, social distancing, mechanical ventilation in the schools. So the kids are actually fairly safe at schools. And I think that trend is going to continue, hopefully, across the country. But you can't ignore that it's still, it's a possibility that spread can occur in the schools as well. And our observation so far has been most of the time, the spread has been in the extracurricular activities outside of the school. That's sports, band, choir, those kinds of activities where the restrictions may not be as strong as they are while the kids are actually in school.
Hey, Jennifer, can I jump in on the back part of that?
Yes.
Which is, Dr. Urbina really brought out an important thing, which is the testing that we're doing. We're not telling people to come in just when they're symptomatic or when they think they might be ill. We want to be able to make sure that that testing is widespread and available for people who are otherwise well, because we know that if we can catch disease early, if we can be able to find those asymptomatic cases, that'll really help us to be able to protect the community. And we've got testing capacity that we can use, especially for that off-campus student population. Parents, if you're listening to this and you've got your student who's living off campus, send them over to the UMC to get a test. Even if they say, I feel great, I don't think I've been exposed to anybody. We want to use that capability as an early warning system for the campus and for the community. And we really need you to jump on that. It's not something where, for a lot of people in the community, they're not getting tested unless they are symptomatic. We want to get there first. So jump in there, get your test.
Thank you. Sarah Huntley, would you mind helping with this next one? I'm hearing city police aren't enforcing public health orders and are ignoring student complaints about parties. What kinds of enforcement is going on regarding off-campus parties?
So thank you, Jennifer, for the question. The challenge we have with parties is that we often get a complaint that will come into dispatch. Our officers need to be able to respond to that complaint. And sometimes that takes a little bit of time if they're responding to other needs across the city. And when they get there, we actually don't discover the behavior still occurring. And so there is often a disparity between the number of calls we receive to dispatch and the number of parties that are documented by police officers. Having said that, we have seen a definite increase in enforcement as represented by citations in the last couple of weeks. Again, I want to emphasize what everybody on this call has been saying, which is that the majority of our student population is doing a really good job, and we're really appreciative of them and want to recognize and value them as residents. But we are having some groups of students, much, much smaller in population, who are continuing to party. Between the 11th of October and last week, we had issued 20 citations related to parties. 16 of those were on the University Hill area, which is where a lot of our off-campus students reside. We also are really partnering closely with our university partners because we know that continued participation in academic life at CU is really important to these students. So we have also referred 20 cases in the last couple of weeks to CU for student code of conduct review. I don't have this week's numbers yet. We usually get updated on those and give them out on our Thursday briefing. But I think you can see that we have had some significant numbers in the last couple of weeks.
Thank you. The next question is related to enforcement going on in the residence halls. So I can take this one and then open it up should anyone have any other responses. But in terms of the residential halls and communities, we are very lucky to have resident advisors, hall directors, and other staff who are in the building who do nightly walks and checking for all kinds of things, whether it's checking in with students who are living there or to make sure that it's a safe and wonderful experience that we can provide. In addition to the RAs and the hall directors, we also have our security, our residential services officers. We have a very educational approach with the RSOs, as we lovingly call them, where we look at any violation as an opportunity to educate, to create a really strong relationship of conduct. And then the collaborative approach is once conduct meets with that student, we're able to offer not only information about the experience, but educational opportunities after. And by doing this, we actually see recidivism or repeat offenders decrease. And so we do have lots of different methods of ensuring safety in the residence halls. For this next question, I will go to Jeff and Pat. Will the state's adoption of the contact tracing app help? And is CU going to encourage students and staff and faculty to enable the app on their phones? So Jeff, maybe the first part, and then Pat.
Thanks, Jennifer. It will help. And if there's questions, I know Kate just did a close look at the app itself. They don't collect private information. The app lets you know if you have been in close contact with somebody who's been positive and can notify you of that. So the more people that use the app, the more likely it is that we can get notified when people have been in close contact for a certain amount of time that would consider them a high enough risk that they should do a follow-up.
And Pat?
So I don't think so far that we've done any messaging to our broader community about the app. That's something that we need to look at doing. I land in the same place that Jeff does, which is in order for this to be an effective tool, it has to be adopted and have enough people using it that it can actually serve as a valuable reference point. So that's definitely something that we need to do. We're still going to need to do our own contact tracing for the people within our community to make sure that we've got that follow-up from an epidemiological standpoint. And we don't want to rely on technology taking the place of the hard work that we've done to be able to train those contact tracers to make sure we're following up and to make recommendations that are specific to the CU community. But we need to use all the tools that are at our disposal to help be able to identify potential cases and figure out how to address them.
Can I ask Kate to just take 1 minute or less to just describe a little bit about privacy? Because I know that's always a big question that comes up with these kinds of things. And we've just had our attorney look into it.
Absolutely. Thank you, Jeff. Yes, with respect to the Colorado exposure notifications, it is important to note that no personal information is collected, stored, or shared by the system. A couple key highlights of the privacy protections with respect to the system is that users have full control to opt in to receive exposure notifications and can turn it off at any time. The service will never track your location. It uses Bluetooth rather than GPS. Your identity will never be revealed to anyone. The system uses codes and keys that do not relate to a particular person. You cannot identify a person from the anonymous codes and keys that the system uses. And the service, again, will never collect, transmit, or store any of your personal information. And the Colorado Department of Public Health and Environment does have extensive information about the system as a whole, as well as its privacy protections on its webpage.
Thank you, Kate. And if you don't mind, can you stay on? This next question would be helpful for you to clarify. Is a group of 8 or 12 students living at the same house considered a household?
So a single household can only have up to 4 unrelated persons. For any residences that have more than 4 unrelated occupants, the person's household consists of such person and any persons with whom they share a room in which they sleep.
Thank you, Kate. Jeff, this next question might be best for you. From what I understand, the biggest factors in rising cases are private gatherings, not restaurants or schools. How will moving to safer level 3 help curb these issues?
Thanks for the question. I'm gonna ask Kate to respond as well in a second, because she just did an analysis of the exposure data on the state's website. But we definitely know that private gatherings have been a source of spread. And if you look at the data across the state, you'll see that around July 4th, there was one bump, and around Labor Day, there was another. So we know that social gatherings are a contributor to that. And again, people just getting together and not following the guidance has been a big issue. And that is what drives the up and downs of these cases. But I will ask Kate to just summarize some of the other places where she's seen analysis from the state's website that indicates where outbreaks are occurring.
Thank you, Jeff. Yes, so public health is actively engaging in this analysis, working with our data team members to really drill down to the greatest extent possible the source of COVID-19 transmission in our community. As Jeff mentioned, personal social gatherings are identified as a hotspot of disease transmission because in these types of gatherings, there may be less social distancing, less face covering, and engaging in socialization with people in close indoor quarters for a prolonged period of time. We are also seeing disease transmission in areas such as restaurants that suffer similar challenges, such as removed face coverings and prolonged interaction among groups. But we are continuing to analyze the data to drill down into the disease transmission sources even further. But I will definitely put out there that personal social gatherings and indoor dining are 2 of the key drivers.
Thank you. So I'm looking at Provost Moore and Pat for a moment, and maybe we'll start with Provost Moore. Assuming that the coronavirus will be around for the spring semester, are there plans being made now to expand outdoor activities, classrooms, and utilizing open spaces on campus for the students to socialize and have more outdoor options available in the spring than have been in the fall?
The short answer is yes. I know the Division of Student Affairs is working on identifying large spaces, some outdoors, some indoors, that would accommodate such gatherings and activities. I also know that in meetings that I had with chairs and directors last week and with the deans periodically, with whom I meet weekly, we are talking about the provision of extracurricular activities and as well as activities outside of the classroom, again, sometimes in large spaces, and if the weather's fine, then we'll do them outside, that might be related to classes. So we would call those co-curricular activities. We have, one of the things we've learned this fall semester is that there's a significant appetite for those kinds of activities for our students and for our faculty. So we are working to develop those kinds of activities moving forward.
Pat, would you like to add anything?
Not much. I think Russ did an excellent job of being able to do that, but it really does tie back into what we described earlier, which is we thought really hard and long about how to make the physical environment of the classroom safe in the fall. And we're recognizing now that we need to be thinking about those social opportunities in the spring, and making sure that we use our outdoor spaces, because we know that the outdoor spaces have less risk of transmission than indoor spaces, as a way that we can help make the student experience better. And we've got really smart people in student affairs and facilities and others who are working on that, because we want the spring semester to be a better experience than the fall semester was for a lot of students. We've heard a lot of people saying that they're getting really great education, but that they're missing out on some of the social aspects, and we need to help provide those safely. So that's high on our list.
Thank you. Jeff, this next question is for you. What does current contact tracing show amongst the positive cases now in terms of how people are contacting or contracting COVID? Is it still from gatherings, workplace, or other situations that you could elaborate on?
I think we just answered a little bit of that, but I
Yeah.
can expand a little more, and I'd ask Chana to add into this as well, or Chris. But we know that we are seeing things, again, when you look at that state website, you'll see that office spaces, work sites are also contributing to spread of the disease. And the bottom line is it comes down to places where people are not social distancing and wearing masks are contributing to those issues. So whether that's in a workplace, in a restaurant, in a social gathering, that's the main driving factor for any of these places that we're seeing spread, is the fact that people likely aren't wearing masks, or they're not social distancing, and they're just letting down their guards. And Chana, I would defer to you or Chris to add anything more qualitative to that.
I don't have anything to add, Jeff. Chris?
As always, Jeff, you're spot on.
Well, we'll keep that going then, Dr. Urbina and Jeff. Here's a two-part question for you. Is there any tracking to determine how many people who have tested positive for COVID have also gotten their flu shots? And then the second part is there any data that points to flu shots helping with the severity of COVID cases?
Chris, I'll defer that one to you.
Sure. Let's talk about the flu shot. The flu shot, we give a flu shot to everybody who's eligible, greater than 6 months of age, and assuming that you don't have any contraindications like an egg allergy or a history of Guillain-Barré syndrome. We've safely given over 100 million hundreds of millions of vaccines over 50 years to lots of people. Occasionally there are side effects. Guillain-Barré syndrome is one of them. Actually, Guillain-Barré GBS, as lots of people call it, actually can be caused by the flu illness itself. So you're more likely to get GBS because it's rare by the flu infection. So because COVID-19 is a novel virus, we don't know exactly the answer to that question. We believe, though, by reducing your contact with all infections, by doing the same recommendation, by wearing a mask, physical distancing, washing your hands, and avoiding large groups, you can actually prevent yourself from getting all respiratory infections. It's as simple as that. So, but getting the flu shot adds another layer of protection. I think we'll know the answer to that question regarding whether or not there's tracking, if they're associated, probably looking back. But I can tell you that my strong recommendation is to get the flu vaccine because it's safe. And if we can reduce the amount of flu in the community, we can actually reduce the amount of hospitalizations and illness. And then as we do all the other things that Pat and Jeff have talked about, we can reduce the spread of COVID-19 as well.
Thank you. This next question may be our last question as I look at time. And I think that this is specific to academics, but maybe we'll take it for an academic approach and then also maybe for testing related to COVID. So Provost Moore, is CU offering exit testing before kids leave for home at Thanksgiving?
Yes, we are. In fact, we've already started developing a fairly extensive protocol for making sure we have the capacity, which we do, and the logistics to provide tests to students anywhere between 24 and 72 hours of them leaving the campus and returning home. And we're going to strongly encourage people to do so. And I believe that capacity will also be provided to some of our off-campus constituents at the UMC, at the SEEK building. And again, if you have a Buff 1 card and you're going to travel, please go ahead and at least get a surveillance test so that you have some assurance that you're not contributing to spread of the disease within and beyond the borders of Colorado.
Want to jump in with two things there.
Yes.
First, don't wait. We've got get a test now and get a test later. That's a good thing to do. You use that testing capacity and don't just say, hey, I'm going to get one before I go home. We want people to be using this. Second is we know that if we got into higher levels and if against all of our wishes, we got into stay at home, that could affect the ability of people to be able to go home and spend the holidays with their loved ones and be able to travel by planes and do those things. So that by doing the right things now, you're preserving your ability to be able to make sure that you have those opportunities to be with family and to have the holiday season that you want to have, so that the investment in the right behaviors now will really pay off on the back end in terms of thinking about how you want to be able to have the remainder of 2020 be. And 2020 has been a really rotten year in a lot of ways. If we can finish it strong and put it into a situation where people can have that respite and go home safely, that's really what we want.
Thank you for sharing that. And as a reminder, our surveillance and monitoring is free for CU affiliates and can be accessed same day. Thank you all for calling in today. If you have further questions, please visit colorado.edu/COVID-19. We provide twice a week updates, 10 a.m. on Thursdays with the city and county, and then today or Tuesdays at noon. You can also give us feedback on the COVID-19 website. There's a chat at the bottom of the screen, a who to contact list, and ask a question box. We'll now end this call. Thank you so much for joining us.
Thank you.